Health centers are very unique communities that provide health care within underserved and poor communities. We at Greater Lawrence provide health care services that include HIV patients, homeless patients, as well as provide pharmacy services and a family medicine residency training program. And we do it in a way that's culturally sensitive, that's welcoming to our patient population, and that ensures a continuity of care that's not found in many other healthcare providers. Because we're owned by our community, we care about our community.
We really utilize a multidisciplinary team approach to make sure that we are delivering the type of healthcare that our patients really need and otherwise have difficulty accessing because of poverty, language issues, mental health issues, all of the different issues that affects them and typically negatively impacts their healthcare outcomes.
An interesting aspect of our comprehensive care approach is that because we have a family medicine residency program here, we've got 40 family medicine residents, we can use those residents to help coordinate comprehensive care management. We can do that with every patient while at the same time training the doctors of the future.
Our residency program was started in 1994 because here in Lawrence we did not have enough doctors to serve the community. Our Lawrence Family Medicine Residency has now developed a national reputation. We attract medical students throughout the country to apply here, and our residents who match here are some of the best throughout the country. Examples of programs that have been developed by residents and faculty over the years was the Healthcare for the Homeless program, was started by one of the very first residents here at the health center who noticed that there are many patients living under the bridge and that they needed care. Today, we are developing programs to treat addiction and having more and more of our residents and our faculty members being able to provide medication-assisted treatment for opiate abuse.
Right now, we estimate we have about 60 to 80 people living in Tent City. What we do as a community outreach organization is our grant is funded to provide HIV services to the homeless or to injection drug users. So basically the way we do that is through two venues, either street outreach or venue outreach. Street outreach is just that, out on the street, meeting people exactly where they are. Venue outreach is where we meet people at either soup kitchens or the shelter.
I see our Healthcare for the Homeless team as being extremely important because we're providing access to care for the most marginalized and probably our sickest patients. When we look at the people who are least served by our traditional healthcare system, these are the folks that we're reaching by going out onto the streets and accessing them. We are 5 part-time providers and we go out to 12 different shelters between Lawrence, Lowell, and Haverhill. And we try to serve people where they're meeting more basic needs of food and shelter. We have a federally funded grant, it's a 330 grant for $189,000. We can waive the co-payments for their medicine. We deliver medicines to lots of the shelters. We have a little Healthcare for the Homeless card so that people feel part of our program. 2009, we served 2,500. 2015, we served 3,200. So the program is growing as the problem is growing.
Once we test somebody either for HIV or hepatitis, then it is our responsibility to link that person to medical care, be it either with Dr. Wade, with the homeless shelter, or actually linking them to services with Greater Lawrence Family Health Center.
Greater Lawrence Family Health Center has a number of different outreach programs for the most vulnerable members of our community. And the one that I work most closely with is the one that's based at Water Street. It's a community-based program that really focuses on outreach to our patients who are actively injecting drugs, those who are homeless, and those who just otherwise don't feel comfortable accessing health care in the usual setting. In addition to the many services that we already provide through the Water Street site, one of the other programs that we have recently been funded to start is a PrEP expansion project. PrEP stands for pre-exposure prophylaxis, and it's the use of a daily medication to prevent HIV transmission in those who are at highest risk for acquiring it.
I'm very proud of the fact that this organization has a culture of caring, that in any one of our health centers we have a passion for our patients and it shows every day. The response and the commitment to excellent quality of health care is, I've never seen anything quite like it until I came here. It is an environment where change is welcomed, We think outside the box, we take risks on behalf of our patients, and the results, the quality results, the healthcare improvements in those communities speak for themselves.